The health challenges faced by Americans are diverse and often rooted in a combination of lifestyle, genetics, and environmental factors. Below is an overview of the 10 most prevalent diseases in the U.S., which significantly impact public health and healthcare systems. Heart disease. Leading the list, heart disease is the primary cause of death for both men and women in the U.S. Conditions, such as coronary artery disease, heart failure, and arrhythmias are common. Risk factors include high blood pressure, high cholesterol, smoking, obesity, and a sedentary lifestyle. Cancer. Cancer is the second leading cause of death, with lung, colorectal, prostate, and breast cancers being the most prevalent. Early detection and advances in treatment have improved survival rates, but the disease remains a major health burden. Chronic lower respiratory diseases, CLRD. This category includes chronic obstructive pulmonary disease, COPD, emphysema, and chronic bronchitis. Smoking is the leading cause, though exposure to pollutants and genetic predisposition also play roles. Stroke. Strokes occur when blood flow to the brain is interrupted, often due to a blood clot or burst blood vessel. They are a leading cause of disability in adults, with risk factors including high blood pressure, diabetes, and smoking. Diabetes. Affecting millions of Americans, diabetes impairs the body's ability to regulate blood sugar. Type 2 diabetes is particularly prevalent, linked to obesity and lifestyle factors, while type 1 diabetes is an autoimmune condition. Alzheimer's disease. As the aging population grows, Alzheimer's disease and other forms of dementia are becoming more common. This neurodegenerative disease affects memory, cognition, and daily functioning, placing significant emotional and financial stress on families and caregivers. Kidney disease. Chronic kidney disease, CKD, often develops as a complication of diabetes or hypertension. The condition can lead to kidney failure, requiring dialysis or transplantation. Influenza and pneumonia. While largely preventable through vaccination, influenza and pneumonia remain significant causes of hospitalization and death, particularly among older adults and individuals with weakened immune systems. Obesity. Although not a disease itself, obesity is a major risk factor for many chronic conditions, including heart disease, diabetes, and some cancers. It affects nearly 42% of U.S. adults, highlighting the need for public health interventions. Depression and mental health disorders. Mental health challenges, including major depressive disorder and anxiety, affect millions of Americans. These conditions not only impact quality of life, but also exacerbate physical health issues and increase the risk of suicide. Efforts to combat these diseases include promoting healthier lifestyles, improving access to preventive care, and investing in research for better treatments. Addressing the social determinants of health, such as education, income, and access to nutritious food, is also crucial in reducing the prevalence and impact of these diseases. Comorbidities refer to the presence of two or more medical conditions occurring simultaneously in an individual, either independently or as a result of one another. These conditions can interact in complex ways, often complicating diagnosis, treatment, and overall health outcomes. Comorbidities are especially common in chronic illnesses and aging populations, where long-term conditions frequently coexist. For example, a person with diabetes might also have hypertension, high blood pressure, both of which increase the risk of heart disease. The interplay between comorbid conditions often necessitates a more integrated approach to care, focusing on managing multiple conditions simultaneously rather than treating each in isolation. Real-life examples of comorbidities: diabetes and hypertension. Diabetes often leads to vascular changes, increasing the risk of hypertension. Together, they significantly raise the chances of complications such as heart attack, stroke, and kidney disease. Obesity and sleep apnea. Obesity is a leading cause of obstructive sleep apnea, a condition where breathing repeatedly stops during sleep. The extra weight around the neck can block airways, leading to disrupted sleep and increased risk of heart disease and diabetes. Chronic obstructive pulmonary disease, COPD, and depression. Living with COPD often leads to reduced physical activity, social isolation, and diminished quality of life, contributing to the development of depression. The psychological stress, in turn, can worsen COPD symptoms. Heart disease and chronic kidney disease, CKD. Heart disease can impair kidney function by reducing blood flow to the kidneys, while CKD often exacerbates cardiovascular issues by causing fluid retention and hypertension. Alzheimer's disease and frailty. Cognitive decline in Alzheimer's patients is often accompanied by physical frailty, including muscle weakness and balance issues. This combination increases the risk of falls, injuries, and further health deterioration. The presence of comorbidities often requires coordinated care from multiple healthcare professionals, including primary care physicians, specialists, and mental health providers. Managing these conditions involves addressing lifestyle factors such as diet, exercise, and stress, alongside medical interventions. Recognizing and addressing comorbidities is essential for improving patient outcomes and enhancing quality of life. Comorbidities are a significant health concern across all age groups and populations, but older adults are disproportionately affected. Individuals aged 65 and older represent the demographic most impacted by multiple chronic conditions. This is largely due to the aging process, during which the body becomes more vulnerable to the cumulative effects of chronic diseases and other health challenges. According to the Centers for Disease Control and Prevention, CDC, approximately 80% of older adults in the U.S. have at least one chronic condition, and nearly 70% have two or more. Why are older adults most affected? Biological aging. As people age, their bodies undergo changes that increase susceptibility to disease. For example, the immune system becomes less effective, and organs like the heart, kidneys, and lungs may lose efficiency. These changes make older adults more likely to develop chronic conditions such as hypertension, arthritis, and diabetes. Longer lifespan. Advances in medicine have extended life expectancy, allowing more time for chronic conditions to develop and interact. While this is a testament to improved health care, it also means managing comorbidities becomes a common part of aging. Lifestyle and accumulated risks. Decades of exposure to risk factors, such as poor diet, smoking, and sedentary behavior, can culminate in multiple health issues later in life. Even for those with healthy habits, the natural wear and tear on the body increases vulnerability. Common comorbidities among older adults. Hypertension and diabetes. These conditions often occur together and are linked to an increased risk of cardiovascular disease. Osteoarthritis and obesity. Joint pain from osteoarthritis can limit mobility, exacerbating obesity and leading to a cycle of worsening symptoms. Chronic obstructive pulmonary disease, COPD, and heart disease. Breathing difficulties associated with COPD can strain the heart, increasing the risk of heart-related complications. Dementia and depression. Cognitive decline is often accompanied by mental health issues, which can further impact overall well-being. Socioeconomic and racial disparities. Within the older adult demographic, certain groups are even more affected by comorbidities due to socioeconomic and racial disparities. African Americans, Hispanic Americans, and low-income individuals often face higher rates of chronic diseases due to limited access to health care, nutritious food, and preventive measures. These disparities highlight the importance of tailored interventions to address specific needs within these subgroups. Implications and care. Needs. The prevalence of comorbidities in older adults poses challenges for healthcare systems, requiring a shift toward integrated and patient-centered care. Geriatric specialists, multidisciplinary teams, and community-based support systems play vital roles in managing these complex cases. Promoting healthy aging through preventive care, physical activity, and early intervention is essential for reducing the burden of comorbidities on this vulnerable demographic. We just want to take a moment to thank each and every one of you for tuning into this video about comorbidities. Your time, attention, and support means so much to us. Comorbidities are such an important topic, and by watching, you're taking a step toward understanding more about health and how it impacts people's lives. Together, we're spreading awareness and empowering others to take charge of their well-being. If you found this video helpful or learned something new, please give it a thumbs up. It really helps the channel grow and reach more people who might benefit from this information. Also, don't forget to share this video with your friends, family, or anyone who could use this knowledge. You never know how far one simple share can go in making a difference. We'd also love to hear your thoughts. Have you or someone you know been affected by comorbidities? Do you have questions or ideas for future topics? Drop a comment below. We read every single one, and your feedback helps me create content that truly resonates with you. And if you haven't already, make sure to subscribe and hit that notification bell so you don't miss any of our future videos. We have so many exciting topics lined up that dive deeper into health, wellness, and more ways to improve quality of life. Thank you again for being here and for being part of this amazing community.